When people hear that their liver needs to grow before surgery, the first reaction is disbelief. How can an organ grow on demand? But in liver cancer surgery, especially when we need to remove a large portion of the liver, this growth becomes crucial. And there's a highly effective technique called portal vein embolization that allows us to do exactly that. In this video, I'll explain what it is, why it's done, and how it helps make major liver surgery safer. Hello, I'm Dr. Kaival, a GI and HPB surgical oncologist. I specialize in complex operations for cancers of the liver, pancreas, and the bile ducts. One of the most important questions we ask before liver surgery is, does the patient have enough liver to safely survive the operation? When the remaining liver, what we call the future liver remnant, is too small, we can actually stimulate it to grow before surgery. Today, I'll walk you through the portal vein embolization, a fascinating technique that has greatly improved outcomes in major liver resections. The liver is the only solid organ in the human body with the ability to regenerate. But even with this ability, there is a limit to how much liver we can safely remove. For major liver cancers or large metastases, we may need to remove 60 to 70% of the liver. If the remaining part, the future liver remnant, is too small, the patient can go into liver failure after surgery. Portal vein embolization is one of the ways of preparing the liver for this challenge. It encourages the remnant side to grow stronger and larger before we operate. The liver has two main blood supplies, the hepatic artery and the portal vein. In portal vein embolization, an intervention radiologist purposely blocks the portal vein branch that supplies the part of the liver that we plan to remove. This may sound counterintuitive, but it shifts the blood flow towards the side of the liver that should remain. The body reacts by stimulating that healthy portion to grow, and over 4 to 6 weeks, it can increase by 10 to 40%. This growth makes the liver safer to operate on and reduces the risk of post-operative liver failure. Portal vein embolization is not surgery. It is a minimally invasive radiological procedure. A needle is inserted through the skin into the liver under imaging guidance, and tiny particles or plugs are used to block the target portal vein branch. The patient goes home either the same day or the following day. Over the next few weeks, we monitor the liver's growth using CT or MRI. Once the future liver remnant reaches a safe size, we then proceed with planned liver resection. This technique is used in patients where we anticipate removing a large portion of the liver. In non-cirrhotic livers, we usually require a future liver remnant of at least 30%, whereas in cirrhotic livers, we aim for at least 40%. Patients with underlying liver disease such as fatty liver or prior chemotherapy may also need portal vein embolization because their regeneration capacity is lower. The goal is not simply to make the surgery possible, but to make it safe. In some cases, advanced techniques like ALPPS, that is, associating liver partition, and portal vein ligation for a staged hepatectomy, may also be used, though these are reserved for highly selected patients due to a higher risk. Another evolving strategy is dual vein embolization, where both the portal vein branch and the hepatic vein of the side to be removed are embolized. This can lead to even greater and faster hypertrophy of the future liver remnant in selected patients. Researchers are also exploring drugs or biological agents that enhance liver growth, but portal vein embolization remains the gold standard because it is predictable, safe, and well studied across thousands of patients worldwide. By allowing the liver to grow in advance, we reduce complication rates, shorten the ICU stays, and dramatically lower the risk of post-operative liver failure. It also allows us to treat cancers that would otherwise be considered inoperable simply because the remaining liver would be too small. In many ways, portal vein embolization expands the boundaries of what is surgically possible. To summarize, portal vein embolization is one of the most valuable tools in modern liver surgery. It uses the body's natural regenerative ability to grow the healthy side of the liver before major surgery. This helps us operate safely, remove larger tumors, and offer curative treatment to patients who might otherwise have limited options. If you found this explanation helpful, please share it with someone preparing for liver surgery or facing questions about resectability. And don't forget to like, subscribe, and follow the channel for more clear, patient-friendly insights into pancreatic, liver, and bile duct cancer care.